This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000. We have the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit kappabootscootin.com.
Hi, welcome to Doc Talk. Doc Talk is the Knoxville Academy of Medicine podcast where we talk about health issues impacting East Tennesseans of all ages in plain language. I'm Elise Demaney, former president of the Knoxville Academy of Medicine, and today I have joining us another former president of the Knoxville Academy of Medicine, Dr. Tony Mardini, who's with the Summit Medical Group here in Knoxville. We're going to talk about geriatric medicine. It's not a dirty word, I promise you. I'm like right up there. Okay, define geriatric medicine.
Well, by definition, geriatrics means people who are the patients who are over the age of 65. It doesn't really apply anymore. It doesn't. I mean, I'm almost there too. So it doesn't really apply anymore. I mean, we have many patients in their 80s and 90s, and they're doing great. But by definition, it's the patients who are past the age of 65.
Okay. Do our metabolisms slow down? What is it about us when we get older?
Lots of stuff happens when we get older. It's mental, it's physical.
Oh, good.
But it really the brain. It's like arthritis. When we get older, we all have arthritis. When you look at, I mean, remember in medical school, when you look at a joint of an 18-year-old versus a joint of an 80-year-old, you don't even have to put 18 or 80. You can tell this is an 80, this is an 18, just by looking at the joint. That's the same thing with the brain. When you look at the MRI of the brain of a geriatric patients, you know, with all the what we call white matter change, which is really more age-related. Exactly, age-related. So it's physiologic, hopefully nothing pathologic, and so this is just part of getting older.
So yeah, it's everybody says if you don't use it, you lose it. Right?
Very important.
Okay.
Yeah. For years, we used to emphasize mental exercises. Now we're doing more mental and physical exercises. Now there's a huge push for not just do puzzles and sit in front of the computers or do more readings. You got to go up there and walk. You got to go up there and do things. You're going to push more blood into the brain. That's actually a better benefit to not just the brain itself, but the heart and the lung and the falls, which is another big deal we deal with. I mean, we have half of my patients are Medicare patients, which is obviously 65 plus, and the fall is there's lots of issues we deal with, not just the memory, it's the falls, the hearing, the vision, lots of things happen when we get older.
Parts wear out.
But you can at least, I shouldn't say preserve it, but you can delay it. You can, and we have many patients in the 80s, and actually I have almost 60 patients over the age of 90. So we have around here, especially we're blessed in East Tennessee, we have many patients doing great and upper 80s, 90s. It's amazing how when you talk to these patients, they have a different look on life. Yeah, they're optimistic, not pessimistic. They're exercising, they're moving, they're doing things. Every day they feel like there's something, there's almost like a purpose in life.
You know, they say so all the time, you know, because I do ear, nose, and throat, and they come and they're losing their hearing. They don't want the hearing aid. And I go, yes, you do. I said, you want to always engage in all the dinner conversation. Don't check out. Don't be like my dad who just goes, And I know he's not hearing anything.
And dementia.
And dementia.
Hearing and dementia. It's amazing.
So I say, don't check out. And they go, well, you know, there's nothing golden about the golden years. And that's not true.
Exactly. That's not true. And it really all depends on how you look at it. And now we do have patients who are obviously in their 80s or even 90s who are sick and not doing well. But you try your best to kind of enjoy life. You want to. You try to, all the other issue with geriatrics that I may mention it, especially to your listeners, we try to minimize medications when we get older. And you remember when we're younger, we don't take too many medicines. In their 30s, 40s, 50s, 60s, you start taking more medications. Well, 70s, 80s, and 90s, hopefully you should take less medicine.
Right.
More medication, obviously have more side effects and affects the geriatric patients more than you and I.
Yeah, their metabolism is slower. They may be more frail. I mean, the worst thing that we can do is give them a medication that makes them a little,
Makes them fall.
Makes them fall. Yeah.
Your kidney functions down, your liver functions. The brain, obviously, like you said, the shrinking of the brain, the white matter changes. We've been ignoring the geriatric medicine for a long time. I mean, I have a sister who's a pediatrician, and with pediatrics, they study 3 years in a residency program to do. We don't have 3 years of geriatrics. We should. But for years we didn't have too many geriatric patients. But now we do. Now we have lots of patients in the 80s and 90s. So we should put more emphasis on not just internal medicine, but geriatric medicine. Maybe fellowship. There are many fellowships in this country, but not very popular, or at least around here, we really don't have too many specialists in geriatrics in the Knoxville area.
So you mentioned medication. Top things that impact our health: diabetes, hypertension, obesity. And they do go hand in hand, and it becomes a vicious cycle. So many of them have inflammation and they want a steroid shot. And I go, no, you don't really want a steroid shot. You can get through this without a steroid shot. It's going to make you hungry, you're going to eat, you're going to gain weight, and then you're not going to want to exercise because then your back hurts or your knee hurts, and it becomes a self-perpetuating, not so good.
I agree.
So is there an ideal number that you try to keep the geriatric population below that number on medications that they take?
Minimize it.
Minimize.
So if somebody, well, you also look at other things that can make them take medication. Like if they're obese, we try to get them to lose weight, because it doesn't make sense to just cut down on medications if they're not going to lose weight. Exercise. If they have sleep apnea, treat the sleep apnea. So you try to figure out how come they're taking 10 different medications, how come they're, and every time I see a geriatric patient, pretty much all patients, but mostly geriatric patients, you always have to go every day, every visit, you go through the medicines. Now, you're still taking this. If they say, oh yeah, I'm taking it all, well, let's see what we can do. Maybe you don't need 2 blood pressure medicines. Maybe we can combine it. Maybe you can take one. So it's, patients are different, and you have to treat them differently. But with geriatrics, it's a challenge, because we need to do more research in geriatrics, and we're not there yet.
Yeah, we don't have enough data. We really don't. And I know a lot of mine who come and they have a dry nose or they have ringing in their ears, and it's because they're on literally 15.
My fault, probably, because I probably
No. 15 medications. And I go, just let's see where we can combine that. And I'm going to send them all to you, because now I know you'll get them down off.
I think most physicians around here, especially the people we deal with, most of them do that. Most of them, the minute you have patients old, especially new patients, you always have to go through the medications, because sometimes what happens a lot of times, they see 4 different physicians, whether it's ENT, whether it's cardiologist, and then there's really this disconnect. There's not much communication between physicians, and we're now hopefully with EHR, hopefully that improves, but we're not there yet. And so you have to, because you have no idea. It was Dr. X and Dr. Y and Dr. this put them on.
Yeah, and it's a really interesting problem, because some of them, they lose their spouse, and then they get depressed, which is appropriate. I mean, that's an appropriate thing. And then they kind of withdraw and they get into that social isolationism. That's very dangerous.
We do a lot with family members too, who come in and with their moms or with their dads and complaining about issues. And it's like the same thing with pediatrics. Remember, with pediatrics, a lot of pediatricians deal with the parents, right, more than the actual patient. With geriatrics, the same thing. It's amazing. It's a circle of life. You just you treat them the same way. Yeah, you talk more. Sometimes I talk more with the family members than the patient, especially if they have dementia, if they have other issues. But you still have to treat the patient first, obviously.
What would you say to somebody who, it's easy, we get so busy, and my contemporaries, oh, I forgot this, I forgot that, I think I'm getting dementia. And I go, no, you probably aren't, but you probably have a lot of things to, that you're not focusing on. If somebody thinks that they're getting dementia, what would you recommend?
We do a dementia workup.
Okay.
So you do a mini mental status exam. You remember that's the stuff we do in the office. We do blood work, making sure their thyroid is fine, B12 is fine, make sure their blood count's okay. They're not becoming type 2 diabetic. Trying to figure out why, why they're having a memory issue. So we, plus the MRI if we have to.
Right.
And then because it's kind of expensive, we try not to do expensive stuff unless we have to. And so,
they need to come down cost on MRIs.
Yeah. It's Medicare is just they're
it's hard.
Mm-hmm. And so we work them up and then reassure them. And sometimes physical therapy or at least walking. I tell them, go up there and walk and see if that'll benefit your memory. We try not to use too many of the medications unless we make a diagnosis.
Right.
The Aricepts and the Nimindas of the world. The minute you prescribe these medications, that's a flag. That means that mom or dad or grandma or grandpa, they have dementia, which can affect their driving, can affect their legal issues in the future. So you try not to use it unless we have to, unless you make a solid diagnosis.
Okay.
If you make a solid diagnosis, then sure you could use all the medications, appropriate medications that you feel needed.
That's so interesting to know. Yeah, I could see that if somebody saw that Grandpa was on that, then somebody would jump to the conclusion where maybe it wasn't so.
And they won't let them drive, and they may be capable of driving. They won't, and there's lots of legal issues that so we try not to do that unless you have to.
Okay. So I need a can of WD-40 every time I get up out of bed now. It takes a long time, so things don't hurt as much, but that's okay. Mm-hmm. Exercise. You said even walking a block is good.
I tell them, especially we're blessed around here, and especially in Knoxville, we have lots of beautiful parks and greenways, and so just go up there and walk for half an hour, and obviously long distance walking, not just 10 minutes walking, if they can. Now, if you're having issue with walking and frequent falls, then we have to address it first. But it would be great to just go up there and breathe fresh air. And it's amazing how leaving the house, driving a car to even Walmart or the mall, and then walking there for a while too, or it's interacting with people. It's all working up here. It's all you're exercising your brain. Just getting into the car and pushing a button or starting the car, that still needs some brain. It's just
check out.
It's amazing. It's just people feel better when they go out there and do things. When they come back home, they feel much better. Or even going to McDonald's and having a cup of coffee or a sandwich. So you have to be active. You have to kind of just be home and just watch TV and read the paper.
Does it go the other way also? So family members need to, if the person can't get out, they need to go and interact.
Would be nice. It's unfortunate we're all busy sometimes, and
right.
So the children are busy, and the grandchildren are busy, and so sometimes it's tough. Sometimes you just have to do it yourself.
I know my dad has dementia, and he doesn't recognize that I'm his daughter, but we have the best time.
Yeah. And you always want to keep him in a safe environment. Yes. As long as he's in a safe environment, that's the most important thing. Oh,
that's not good.
But as long as they're in a safe environment, and as long as they you're just taking it one day at a time. That's all you can do in life. You just take it one day at a time, keep them safe, and then try to minimize their medications and keep them healthy, and that's all you can do. I mean, sometimes there's not much you can do about it.
Final thing, falls. Falls is a big problem. Huge for this demographic.
A huge problem.
What do you advise?
Well, first thing we try to figure out, why are they falling?
Okay.
Is it the medication? Is it our fault? Are we putting them on too many medicines that's making them fall? Is it nutritional? Is it something in the blood work? Is it anemia? Is it hypotension, which is medication sometimes related? So if we rule out everything, then we do actually send them to physical therapy for fall exercises and prevention, and that works great, by the way. Now they can still fall, but the chances would be much less. If they have osteopenic or osteoporotic, you have to treat that too. So hopefully they can fall out and not break anything, especially ladies. But even men, when we get older, we have issues with osteoporosis too, especially thin men. So let's there's no one person, there's no one way. You're trying to figure out what's going on here. Why are they falling? What can I do? Is it something that can be fixed? And if it can be, we should. If not, I never discourage people not to get up and walk and do things, but it has to be in a safe, whether it's a walk or a cane or safe environment. Not to wander long distance, obviously, not be around the house where you can get some help. Or sometimes we use the lifeline, the push button thing. So there's many ways. It's people are different, so you just have to look at the patient, look at their environment, talk to the family members, and come up with a plan. So even if they fall, hopefully they can seek some help, but hopefully not to fall.
We can talk on this further on down the road, where they have geosensors that the elderly now can wear while they're around the house, and that sensor will automatically sense a change in the weight or the attitude of the body relative to the floor. Wow. And they'll send to your office, Dr. Tony, Mrs. Jones fell down, and then you can call her and say, Mrs. Jones, how are you doing?
Wow, yeah. That'd be beneficial.
I think that those days are not too far distant in the future. So as we get more technology. So there you have it. That's just starting to uncover the entire Titanic iceberg of what geriatric medicine embodies. We aren't so very much like children who enter the world as pediatricians, and geriatrics is not very much different. I bet all of you have actually thought about that. And it's definitely not a time to withdraw from life, because it's wonderful and is to be enjoyed in the fullest. And Dr. Tony's going to help us do that. So if we have questions and need to come see you, how do we do that?
Well, I'm part of a Summit Medical Group, and my office in West Knoxville. So they can just Google Tony Mardini or Anton Mardini.
Anton.
And then
phone number
865-691-0733. I'll have to, I always forget my phone number. I never call myself. And the email would be amardini@summithealthcare.com. All the Summit physicians pretty much have the same. So amardini@summithealthcare.com.
Okay, great.
And thank you. Thanks for your time.
Thank you so much for joining us today. And that's a wrap.
This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000 will give the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit kappabootscootin.com.